And I'm joined now by Daniel Montoya from Washington. He's from the National Minority AIDS Council. It's a non-profit organization that addresses the AIDS epidemic in minority communities across the United States. Daniel Montoya, do you welcome these over-the-counter kits?
We certainly do. We were very, very excited that the FDA approved, I might say unanimously, the recommendation to move forward on this over-the-counter HIV test.
I suppose one of the concerns is that at the moment, if you go for an HIV test, you will receive counselling, about what might happen if you are positive and so on. The concern is that somebody finds out that they're HIV positive sitting alone in their home, and that could have quite a profound effect on them, couldn't it?
It very well could. I think even when they go to their doctor's office, it could have a profound effect on you, just when you talk about mortality in general. But I think the importance of this in-home testing kit is that for it's been a wide sort of understanding that there is a lot of stigma associated with HIV. And for many people, that's really prevented them from going in and get the test. We feel like this particular test will allow somebody to test privately in their own home. There are some considerations that the company did put in place with regard to ensuring that there's a 24-hour hotline to call and that there's some clear instructions about what this test may or may not mean.
Yes, because there must be a concern that the news would be so devastating that they may become suicidal, for instance.
I think that the community certainly took that into consideration, but I think we also look back to the days of when the early pregnancy tests were being developed for women. And I think even back then, if you look back at that particular period of time, there was some consideration that maybe women, especially women who did not want to be pregnant, would be sort of, prone to potential concern regarding their health. And so we felt like, because that didn't pan out, we didn't think that that should be the reason as to why we should move forward with this over-the-counter test.
Do you think this will have a significant impact on the spread of the disease?
Actually, actually it will. I think in one of the points that you brought up, I think you said that 1/5 of the people do not know of their HIV status. And out of those 1/5, those are people, those individuals are 3 times more likely to potentially transmit the virus because they don't know they're HIV positive. There is much research that has been done that someone who already knows their status is much more likely to not only take care of themselves, but to take steps to prevent the transmission of that virus moving, in their life.
And what about the risk of faulty results?
I think that's always a concern. Sure, I think that's always a great concern, but I think that, again, I think the over-the-counter test is something that you can test that I think you then need to follow up with your doctor or some sort of healthcare professional to get a second reading on that to make sure that you understand that it is an actual positive test.
Daniel Montoya, thank you very much.
Thank you.